Good afternoon.
Good afternoon. Welcome back to the LTI podcast, where we talk about research for laser therapy providers. That's what we're going to be doing today. This is a massive episode. It probably won't take us that long to get through it, so hold on. Don't bail on me yet.
Don't bail.
But I think it'll actually be super useful. So before we get started, I want to tell you who we are. This is Christy. She's one of our certified laser techs, and she's also the head honcho for developing the online course materials that we offer to clinicians who are training in laser therapy. If you are a clinician, a healthcare provider, and you want to know how to use laser therapy for your patients, we've got everything you need. We've got tons of free tools on the website. You can sign up for training. You can sign up for online courses. We can help support you the whole way.
Yes.
So, happy to do that. Check us out, lasertherapyinstitute.org. And my name is Jason Roundtree. I am a chiropractor and certified medical laser safety officer. I'm the founder of LTI. So if you do some of our training, you'll have to suffer through the sound of my voice a little bit, but we try and make that as painless. Well, Christy tries to make that as painless as possible. Really engaging course content. So highly encourage you to check us out if you've got any questions about training and using laser for your patients. So one of the steps in using light therapy for patients is to figure out which light therapy device you're going to get.
Right.
It's a really important step.
It really is, because there could be a number out there, but they're not all as effective as others.
That's right.
So.
That's exactly right. Yeah. And if you're going to spend your money, you want to spend it on something that's going to do you good. You don't want to spend it on something that you hope is good, or built on hype or over-promising sales guys, or publications that look good but don't have a lot of meat behind them.
Well, that's why we provide the research. For one, is to help guide that, and then your patients are just going to be that much better off.
Right. Yeah. We want to see patients get better with laser therapy. We want our clinicians that we've trained to be successful with that. And so that's the motivation for talking about this. I don't have a brand I'm telling you to buy today. I don't have a particular unit I'm going to tell you to buy today. No. If you want to know about specific units, shoot us an email.
Right.
info@lasertherapyinstitute.org. We'll be happy to talk. But this is just to give you, hopefully, some additional insight into wavelengths.
Right.
So wavelengths are going to be a key component, really the number one thing that I believe you should be looking at when it comes to choosing a laser for your clinic or a light therapy device. So let's quick review on what a wavelength is. It's basically the color of the light, right? Green is a different wavelength from red. Those are different wavelengths. They're on different parts of the EM spectrum. So as we talk about some other non-visible light, like UV rays or infrared rays, those are still in the category of electromagnetic radiation, not ionizing radiation in the case of infrared, not dangerous.
Right.
But different colors. And even though the human eye can't pick this up, that's probably the easiest way to really think about it is, different bands of infrared and visible light are all different colors.
Right. Well, you can look up light spectrum and see all the different colors and see find where we're talking about within these wavelengths that we're going to talk about.
Yeah, absolutely. Yeah, just and we've shown that picture
Many
before
times.
too. Yeah, but just Google electromagnetic spectrum. You'll see it. You've got gamma rays and UV rays on one end, and then on the far other end you've got radio waves, and and so you've got this wide spectrum. And humans can only see a very
just
tiny,
a little small speck.
tiny bit of that spectrum, but there's a lot more color out there, if you will, colors that we just cannot detect. And so think about these different wavelengths as different colors, and as different colors they behave differently, right? We know that light travels through different mediums in different manners. So through a vacuum, light just travels, right? That's why we can see starlight. Through water,
it gets refracted and bent. And just, it's like, wait a minute, it goes this way, but it's over here.
Hey, you have scattering, you have, and that's why the ocean looks blue, right? Because of the wavelengths that it will and will not transmit. And so different colors behave differently, right? So realize that light interacts differently with tissues based on the color it is, and also on the tissues it may be encountering. So when we're talking about laser therapy, we're talking about putting light and photons into the tissues. So we need to know how they're going to behave. We've done previous episodes to go into like excruciating detail on how those wavelengths behave in the tissues, right, Christy?
Right.
Yeah.
You can search all of our podcasts and find all the information you want.
Yeah.
So.
Yeah.
Or
yeah.
email us,
Or email us. We'll connect you with the
help
right
you.
episodes. We got over 100 episodes now to sort through. So, so I don't want to spend a lot of time today talking about how each wavelength travels through or absorbs in tissues differently. I just want to talk about what happens once the light is absorbed. Okay. So, and absorption is key. You have to have light absorbed to have it be an effect. Otherwise, it's just passing through or going next to, the tissues rather than having an action. We know that light does interact with tissues, right? I mean, if you walk outside on a sunny day, you're going to feel
warm.
Yep, exactly.
And
which
your
means
skin might turn the color of red.
Yes. Yeah. Right. And you got broad spectrum light in that case. You've got some infrared. You've got visible light. You've got UV. And light down on that end of the spectrum, on the UV end, can be dangerous. It's ionizing radiation, which means it causes damage to the DNA. Once you're up into visible light, that's not the case. So visible light on up through infrared, you're not talking about ionizing radiation. So no DNA damage. But if we go outside and we get sunlight on our skin, what do our tissues do? They get warmer, yes, but they also manufacture vitamin D. Right? So we know that that's a process by which the skin is receiving these little energy packets and then is able to transfer that visible energy or invisible energy into vitamin D. In this case, invisible UV rays get transmitted into vitamin D. So we know that light packets, photons, can have an effect on the tissues, right? But it is dependent on the color of the light and the color of the tissues, right? You'll absorb more light if you walk outside with a dark t-shirt on. Right? Yeah, I mean, it makes a big difference.
But you reflect more of that if you're in light colors.
Exactly. Yep, so you don't absorb as much. And we already said light has to be absorbed in the cell if it's going to have an effect. So you think about different parts of the cell as being different colors of t-shirts, right? So in the mitochondria, there are actually 5 mitochondrial complexes in the electron transport chain, and each one of those is a little bit different color t-shirt, which means it absorbs light in a different way.
That's a good way to put it.
Does that make sense?
Actually, it does.
Yeah. Yeah, we'll have to do some kind of cartoon with that.
Yes.
Dress all the little electron chain components up in different colored t-shirts. But that means that they behave differently depending on what light they might be exposed to. And that's the case for many, many components in the cell. They're all different colors. They all absorb light in different ways, different kinds of light. So we therefore have wavelength-dependent cellular effects. That's what I want to really try and get into today, is what are those cellular effects based on the wavelength that we're talking about.
Okay.
Right? So we'll see what you think. Understand that there's about 170 different studies that have gone into what I'm going to present to you today. If you want the list, I will send it to you.
I was going to say there's a test after this. No,
thankfully not.
We'll send it.
we can definitely send the links. I will tell you, it's taken me months and months and months to collect this data. I don't know, maybe even years. But essentially, I'm going to the research, and I'm just pulling out what we know happens in the cells and the tissues, aggregating that data, and then seeing where wavelength dependent, where these wavelength dependent effects are strongest. So,
thanks for doing all this work.
Well, yeah, I mean, it's something that really interests me, but I know it has value to other people.
Oh, definitely.
If you're looking for a laser therapy device, you want to know that the wavelength you're buying is going to be the most effective for what you want to do.
Right.
So that's what we're shooting for here.
That's what we do.
So the focus on with what we're going to talk about is very cellular and tissue dependent, meaning that we're not really worried about the power level, or the frequency at which light is flashed, or any of the other parameters, from really just looking at what happens in those cells once the light does get there, right? Just in general.
Okay.
Also, we're going to be talking about these wavelengths as a range or a band, between, say, 630 and 690 nanometers, because wavelengths within that range all behave pretty similarly. Yes, there's a little bit of variation, but generally, if it's in that band, we can count on it to do those actions.
Right.
So, do you want to start with the best wavelengths or the worst wavelengths? It's up to you, Christy.
Oh my goodness. Let's start with the worst and then end on the best.
Okay,
that way
let's do that.
High on our mind.
Okay, good. So what are the worst wavelengths for a laser therapy device? That's really the question that I want to try and address here. Well, the number one worst one you could pick would be ultraviolet, because it's ionizing radiation. You're just going to be giving people cancer.
And that's not a good thing.
No, that's generally what we don't want to do. Now, there is very limited use of UV light therapy for certain skin disorders, but if we're just talking about delivering light in a way that is helpful to the body, therapeutic and safe, UV is not it.
No.
So anything that's below 400 nanometers is a no-go. Just write it off. It's UV. If somebody's trying to sell you a UV therapy device, probably don't want to trust them. Now, of course, you're going to find some UV in things like tanning beds. So I'm not going to say that you should never expose yourself to UV. What I'm saying is, if you're looking for a therapy device, UV is not it.
And so you can't go outside if you want to avoid UV.
Yeah. Well, look at how pale I am. How much do I really get outside? I've got a little bit of sun, but yeah,
so
I do try and wear my sunscreen. So don't look at
use.
UV. Nothing below 400. Now, the next worst one is, according to everything that I've been able to compile, is between 400 and 430 nanometers. That's down in the deep blue violet wavelength zone. There's very little evidence for benefits for this particular wavelength. There's some benefits, but it's very minimal.
Okay.
There's pretty good evidence that this wavelength will impair stem cells, will impair the mitochondria, and actually has mitochondrial inhibition effects, and it can even induce apoptosis or cell damage. So the mechanisms for that aren't totally clear, but it's just very, very high energy photon. Each photon at a different wavelength has different energy levels, and these violet wavelengths are very, very high energy.
Okay.
There's also extremely poor tissue penetration. This does not make it past the first few microns of skin. I mean, maybe a millimeter into skin.
And that's not very deep at all.
It's not. So if you want to affect any deeper tissues, you're probably not going to get that with this particular wavelength. Now, there is some usefulness, again, with some skin conditions and with fungal conditions like toenail fungus. There's some level there because you can actually damage fungal cells using this light at very, very low risk.
It's more surface level.
It's very surface level. However, if you're going to use a violet wavelength, definitely look at the parameters. Understand you need very, very little power in most cases, and be aware that there's not a lot of evidence for really good benefits. So, no UV, probably no violet or 400 to 430. There's just not a lot of evidence saying that it's good or safe. And the next one is going to be between 700 and 780 nanometers, that range right there. Now, that is just on the other side of red, so it's just barely invisible to the human eye, just past red into infrared. And this is a really interesting wavelength or band of wavelengths, because, and we're going to talk about it in a minute, but there's great evidence for wavelengths in the red spectrum, up to about 700 nanometers, and there's amazing evidence for wavelengths from 790 to about 850. We're going to get into that in a minute. But there's this weird zone here between 700 and 780 where there's extremely weak evidence for any level of benefit. There's a little bit of evidence out there, but not much. There's also some evidence that it can do this mitochondrial impairment and can even accelerate tumor growth.
Again, not a positive thing.
No, not really. Not really what we want to be doing. So if you're looking at laser, laser therapy devices, that's a band where you're less likely to get good benefits and potentially have some evidence of having some level of harm. Pretty minimal. You got to understand when we're talking about any of this harm, we're talking about, usually
Prolonged.
temporary.
Yeah.
Yeah. Prolonged, very high energy exposure would be bad, but brief exposure, it's probably fine. Yeah. But still, you want to be doing something beneficial, right? So the last zone that I have that I'm going to say is one of the bad ones, or one of the less desirable wavelengths, is going to be between 930 and 950 nanometers. That's a pretty narrow band, but in that zone, absorption in fat is actually very high, and for whatever reason, that seems to really just limit the amount of positive effect it can have. So very, very weak beneficial effects, limited to stem cell proliferation, which more stem cells is good, but that's really about it. Very, very poor evidence for any other benefits, and there are some level of studies that have shown some negative effects as well for the tissues.
Wow.
So to recap, don't get UV. Definitely be careful if you're using 400 to 430. You want to know a lot about that violet wavelength. If you're in the 700 and 780, there's so much better wavelengths to do that with. And then 930 to 950, you really can't, I think, expect a lot out of that particular wavelength band.
So I know we don't go into specific units, but are there many units that have these wavelengths? Even? There's
actually not.
Okay. So
right, because manufacturers have the same data that I've got, right? They can look at this just as well. And again, I'm not a researcher. I'm just a clinician who wants to know what I need to be using for my patients. So right. I'm just aggregating this data from, 170 some studies.
Yeah.
So, but the manufacturers are seeing the same thing. That's why you don't have therapy lights out there in UV. That's why most of the therapy lasers out there don't use that 700 to 780. So, and then there's very few in that 930 to 950 range. There's not enough benefit that's been shown. There are some studies on those, but not that many. Now, there are some therapy lights in that violet range. Again, very, very low power ones, which is where it should be, really. You shouldn't be having high power violet. Right. Makes it more dangerous. But these are pretty minimal. Again, more targeted towards like toenail fungus and then some skin conditions. Generally, that's what we're seeing.
Okay.
So those are the ones that I would say
steer clear of.
Yep. And violet's the only one that I would say, there's interesting things that can go on with that one, but you definitely want to know what you're doing and you want to be well trained before getting into that one because it's just more complex.
Yeah. And then the colors just keep going.
The colors do keep going. Let's talk about the good ones.
Yes.
So, what do you think the number one ranked wavelength is going to be?
I'm going to say somewhere in the 800.
You're exactly
range.
Right. Yes, you're exactly right. 800 is what I'm putting at the top of my list, and I think a lot of researchers would probably put it at the top of the list too. We've got more studies on 800 than just about anything else. And when I say 800, we're talking between 790 and about 850.
Right.
There are so many studies out there that we have very, very good data on what it can do. And there's no information about negative effects.
That's amazing.
Yeah.
Usually you can find one nugget or two or a few, but to have no negative information.
Can't find anything negative on this wavelength band.
So
fantastic. If you are listening to this and you know of something, if you know of a study out there, let me know. Please send it to me. I will add it to my weird matrix that I've made up here with all these studies. But as much looking as I've ever done, I've found no evidence for negative effects with that 790 to 850 range. The nice thing with this range too is it's got the deepest penetration. So it's going to get in the deepest to those tissues if you want deeper penetration.
Right.
Research has shown excellent mitochondrial effects, cell proliferation effects, improvement to damage and improvement in the damage response, improvements in wound healing, inflammation control, angiogenesis, collagen production, and neural stimulation. all with this wavelength. So if you can only get one,
this would be it.
that's the one I would say you want to get. We've got the most research behind it. We cannot find anything wrong with it that it does any level of damage at all. And you can treat a lot of different disorders within that. If you can stimulate cell proliferation and neural stimulation, there's your TBI injury, your TBI treatment right there. If you can stimulate angiogenesis and collagen production, that's fantastic for wound healing. That's what the studies show. Excellent for wound healing. You want to work on pain. This helps with inflammation control, so that's going to be helpful for pain. It's a do a lot kind of a
jack
wavelength.
of all trades wavelength.
Yeah, it does really well, really well.
So
I'm a fan of that one.
yes.
The next one, the one I'm going to put in second place, but not far behind 800, is in the visible red 630 to 680. Okay. Again, we've got so much research on this particular wavelength. This one has actually been studied longer than any others. Red
Really?
is where we started with photobiomodulation. That's where it was discovered, with hair growth on mice, right?
That's an amazing story.
Yeah.
Should have them look it up.
Yeah, look it up. Look up the father of photobiomodulation, or father of laser therapy.
Yeah.
Hungarian surgeon who kind of accidentally discovered. Yeah.
Discovered that.
Yep.
Hair growth.
Way back in the 60s.
Yeah.
So it's extremely cool. But that's why we have so many studies that have been done on this visible red, and it does have great effects. Very good evidence for angiogenesis, wound healing, increasing ATP production, inflammation control, stem cell proliferation, and mitochondrial stimulation as well. There's pretty minimal penetration. That's the one downside, is that you can't deliver this light in very deep. But you don't always want deep penetration,
Right. But you can also use combinations.
Don't steal my thunder.
Spoiler alert. Sorry.
No, that's exactly where we're going to end up. But yeah, there are many times where you do want to deposit a lot of energy in the surface tissues. Those surface level nerve endings are important. And, red light doesn't really get past the skin, not very well, but it can get deeper than a lot of the other visible wavelengths. And so it's certainly one that is high on my list. Yes, just behind 800, that 800 range, but still excellent. Now, there is a little bit of evidence that it can stimulate faster growth of tumors, mainly at very high doses. So again, with red, visible red, this is one that you would probably need lower doses of and be very, very happy with. Got to understand, if we're talking about light that can't penetrate deep, it doesn't matter if you turn the volume up, it's not getting any deeper. Right? It's all going to be absorbed to the surface. So the only thing you're going to end up with is potentially some heat, which is not the goal of this whole thing. So you don't need a lot of power with red. But with your 800, you're penetrating deep. So the more you can push into the tissues, the more you're going to get down to those deeper levels. Okay. All right. So that's my top number 1 and number 2. Third place, 1064.
I was gonna guess that one. That's where I was headed. So.
And this is less studied by a lot than the other two wavelengths. However, in the last 10 years, there's been a ton of studies coming out on it, and every study that comes out is showing really good benefits. So amazing penetration, almost as deep as 800. It does have very good evidence for neural stimulation, for wound healing. It has beneficial hemoglobin and tissue oxygenation effects. It has effects on nitrous oxide and reactive oxygen species, which have to do a lot with speed of healing. Also has effects on stem cell proliferation and stimulation of the mitochondrial components as well. So it can do a lot that the 800 can do.
So why would you need both?
So why would you need both?
Why would you choose one over the other? Or
yeah, no, that's a good question. Really, I think you could probably switch those with each other. You could probably use either one and do well. Where it gets a little bit trickier is with your patient population. So 800 is absorbed pretty pretty well by melanin, which means in your darker skinned patients, you're not going to get that deep penetration.
Right.
So you look at 1064, it doesn't absorb in melanin well at all. So in your dark skinned patients, it's going to transmit better. Okay. So if you treat a lot of type 1, type 2 skin type, even type 3 patients, you're going to be great with 800. But if the majority of your patients are type 6, type 5, you probably want to look more closely at the 1064 because you're not going to have to fight that surface level absorption. You're going to be able to get your light in deeper with less heat.
Do it right. I was going to say with less warmth there.
Yep.
Yeah.
Yep. Exactly.
Okay.
Exactly. So, again, 800 is really top. It's got the strongest evidence. That 660 area, 630 to 680, that's fantastic. And it's really good. And it gives you that superficial component that you can pair with these deeper penetrating wavelengths. But 1064 absolutely should be, I think, on everybody's radar to consider, especially, again, if you're dealing with a lot of darker skinned patients. So
that leaves
combinations. Yes. So we've already alluded to this, but there's some limited evidence that combining wavelengths can work better for certain pathologies, and even then those wavelengths can individually. So there's a couple of interesting things here I wanted to point out, and if you have other thoughts on this, please let us know, or if you want to know more about this, definitely let us know. But combining 905 and 1064 actually stimulates all 5 mitochondrial complexes in the electron transport chain. So there's 5 of these. Most of the time with infrared laser, we're talking about complex 4.
Okay.
If you've heard about mitochondrial, if you remember much about the electron transport chain, complex 4 is kind of the rate limiting step. So it's the funnel. Everything's got to get through number 4 before it can do well. So speeding up, opening up the funnel at complex 4 does a lot for speeding this whole thing up. Right. And we know that several of these wavelengths do that very well at complex 4. But if you take 1064 and you take 905, you can stimulate that chain from start to finish, all the way through complex 5, which is ATP synthase.
And that's what we're going after.
That sounds pretty good to me. I mean, you might not really need to stimulate all the different components, but it's a really interesting idea that you could stimulate not just that rate-limiting complex 4, but complex 1, complex 2, 3, 4, and 5. And you can do it with just those two, 905 and 1064. It's interesting.
That is very interesting.
We also know that 980 provides really good superficial stimulation effects. So, we know 660 does as well, but 980 or 970, somewhere in that range, is a nice little window where you can get good stimulation, blood flow to the more superficial tissues. So that's a good one to kind of throw in the mix too. What? I can see you're processing your thinking.
I am, but I'm going to hold.
Okay.
So
the next thing is, I don't want to ignore the visible wavelengths here. We didn't really talk about them too much, other than violet and red. But 440 blue, in combination with 660, may just be about the best thing we can come up with for wound healing. With 800 providing a little bit of more depth, because your 440 and 660 are going to be very superficial. 800 can get in, deeper into the wound bed. But 440 and 660 do have some extremely interesting effects that show bactericidal effects, as well as speeding up the mitochondrial process, and for wound healing. And combining those could be really, really impressive.
I was wondering where blue light came in, because I've heard blue light, and it's a common thing, and I hadn't heard you talk about blue.
Yeah.
So.
The thing is, blue can have some negative effects. And again, really on the higher dosing side, so you need to be careful. You need to know what's going on with blue before you jump into it. Like, you can jump into 800 nanometer light, and you're never going to hurt anybody, If you have a good device, it's got 800, it's not going to have these negative effects. Could you potentially have some negative effects with blue or violet? Yeah, you could. You could. So you want to make sure that people, that practitioners know more about this before you just go, oh yeah, I just throw blue light at everybody. Probably not the best idea.
Well, you don't want to just throw light at anybody just willy-nilly anyway.
That is true.
That's why we train.
That's why we do what we do. Right. Yeah. You don't want to just be throwing light out there and hoping that it works.
Right.
You want to know that what you're going to do is going to work. And it starts with your wavelength selection.
Mm-hmm.
Last one I'll mention here is that 535 green may also combine really well with 800 or 1064. Green laser doesn't have a lot of evidence for negative effects. It doesn't have a lot of evidence for positive effects either, but it's out there. And it may be an interesting one to throw in there. It's probably one we'll see more research on in the near future. Right now, it's a little bit too light on the research for me to really recommend it.
Mm-hmm.
But I think it probably has some interesting effects that you could, combine with other lasers. So that's the rundown.
Nice. Very interesting.
So
wasn't surprised about a couple of them, but
yeah, right.
Hearing the rest and the cons and pros behind it is very helpful.
Well, and I showed you how I came up with all this info, right? Because I'm not quoting you a single study from today.
No, it's a list, and like Dr. Roundtree said, we will send you the list if you want it.
If you want it, you can suffer through it like I have.
But let's take what his synopsises are. And
I'm just basically I'm pulling everything that's wavelength specific in the databases out there, and then putting it in a chart, what it does at that wavelength, and then collapsing all that data to say what is supported and what is not. It's science. It's ever developing. We're probably going to learn more about all this stuff. If you've got
constantly.
Oh yeah.
Constantly.
If you have some studies in mind that you think would fit into my my conglomeration of all this data, send it to me. I'd love to see it.
Yeah.
I had people doing that over the last 3 months, actually sending me studies on these wavelength dependent actions in the tissues and the cells. I realized we didn't really talk on like knee pain, back pain, neuropathy pain, anything like that today.
But you need to know what's going to be effective for that.
Yes. And people want to know, what are these different wavelengths doing? There's very specific actions. There's big differences between them. And ultimately, you've got to make sure you've got the right ones or your patient's not going to get better. So for the best overall cellular and tissue effects, I'm going to want 660 and 800. But I do treat a lot of light-skinned people and not as many dark-skinned people just because of the location where we're at. So if I treated more dark-skinned people, I'd want 660 and 1064. That'd be my pick. I'd combine those two for sure. Like, that'd be my minimum. Because I feel like I'd be missing something if I only had 660.
Right.
I feel like I'd be missing something if I only had 800.
Right.
But you give me a couple of those, and hey, I can work with deep tissues and superficial tissues, and I know that they're safe, and I know that they're supported by the science. If I get my way, I'm going to throw 905 in there too, so we just kind of complete that full electron transport chain stimulation, and it's got some really good oxygenation, tissue oxygenation effects. And then if I get my way too, I would like to add in, a 980 for that more superficial stimulation. And I'd like to have blue. I understand blue light pretty well. I'd like to be able to engage that when I want it. Not in every case, but in some cases. And I wouldn't turn down a little bit of green, a little bit of 535. Again, to use in certain cases. But so do I want all the lasers? Yeah, I want everything.
You always want it all.
Yeah.
Like we all do.
Yeah. But if you're looking for somewhere to start,
but
660, 800, those are great places to start. If you can pick up a combination unit, there's many laser combination units out there with multiple wavelengths. I've got one right now that's got 660, 800, 905, 970, 1064, and 445 as well. So
and the beauty of that is you can use them all in combination, or you can turn some off,
Yeah.
And that's where you get into the settings and the power and the intensities, and we're not going there today.
No. Matter of fact, you probably don't want to get into that. We've already done it for you though, so you don't have to worry about it. You can just plug in our settings to your laser device, and boom, you'll get the tissue and cellular effects that you're looking for. So let us know if you're interested. We'll be happy to connect you with more information about our training programs. If you want these references, again, As long as you know what you're asking for, you can have them. So hopefully today was helpful. If you have questions about a particular laser unit, if you have questions about wavelengths, if you've got some studies you think I might have missed out on, or I didn't say quite the right thing, please let me know. I love a good debate.
Yeah.
It's the only way we learn.
It's the only way and just more information.
That's right.
Sounds good.
Thank you. Thanks for joining us.